Thank you to the ICS for this opportunity to present our work. My name is Michelle Van Kuiken, and I am an assistant professor of urology at the University of California, San Francisco. Today, I will be presenting our study titled Frailty is Associated with an Increased Risk of Complications and Need for Repeat Procedures After Sling Surgery in Older Adults. Our study is funded by an R01 from the NIH, and my institution has funded my attendance at the ICS meeting this year. To begin, frailty is a measure of physiologic vulnerability that increases the risk of an adverse outcome when faced with a stressor. As the population ages, the number of frail individuals seeking incontinence care will only continue to rise. And it's important to note that while frailty can correlate with age, these measures are not the same. Persons of similar age can greatly differ in their level of frailty, and thus also can vary in their risk of having an adverse outcome. In regards to urinary incontinence, we know that stress urinary incontinence is the most common subtype, and it affects more than 50% of women over the age of 60 in the United States. Sling surgery is the most common operation performed for this indication in the United States, and while there is robust data on the outcomes of sling surgery in younger and middle-aged women, there is a paucity of data on outcomes in older, more frail women, as this population is generally excluded from trials. In order to assess this gap in knowledge, we assess the impact of frailty on both short and long-term outcomes after sling surgery in women ages 65 years and older. Using Medicare claims data, we perform a retrospective study using a 100% sample of all women ages 65 and older who underwent sling surgery from 2014 to 2016. To stratify women into categories of frailty, we used a claims-based frailty index that was specifically designed and validated for use with Medicare data. This index uses a weighted accumulation model that takes into account 93 different variables, including diagnosis, procedure, and medical devices, including things such as walker use, wheelchair use, or hospital bed use. Using this index, women were then stratified into 4 categories of frailty: not frail, pre-frail, mildly frail, and moderately to severely frail, in accordance with existing literature. For our study, we assessed both short and long-term outcomes. For short-term, we looked at 30-day complications of surgery, which included cardiovascular, pulmonary, thromboembolic, neurologic, and infectious complications. As urinary tract infection was the most commonly observed complication, we chose to analyze this data separately. Long-term outcomes included mortality within 1 year of surgery and the need for repeat procedures, either for persistent incontinence or obstructed voiding at 1 year. As for results, nearly 57,000 women underwent sling surgery during the study period with an average age of 74 years. The majority of women were white, and the majority of women were not frail or pre-frail, with only about 5% of women being mildly frail and a little less than 0.5% that were moderately to severely frail. In regards to 30-day complications, as the claims-based frailty index increased, there was a steady increase in observed complications peaking at 56.3% in moderately to severely frail women. On multivariate analysis, after accounting for age and comorbidity, frailty remained independently associated with an increased relative risk of complications after surgery. As mentioned previously, urinary tract infections were the most commonly observed complication, with 15.1% of all women developing a urinary tract infection within 30 days of sling surgery. Again, however, urinary tract infections followed a similar trend with steadily increasing rates, with nearly 40% of moderately to severely frail women experiencing a UTI within 30 days of surgery. Again, after accounting for age and comorbidity, frailty remained independently associated with an increased risk of urinary tract infection. Looking at long-term outcomes, the overall rate of observed mortality within 1 year of sling surgery was low, as one would expect, at just under 1%. However, 1 year mortality markedly increased to nearly 10% in moderately to severely frail women, and frailty was strongly associated with an increased relative risk of death at 1 year. In regards to repeat procedures at 1 year, we combine the mildly to moderately to severely frail groups due to a small number of observed events. Repeat procedures were observed at the highest rate in the mildly to severely frail group. Notably and importantly, on multivariate analysis, only frailty and not age or comorbidity was associated with an increased relative risk of having a repeat procedure at 1 year. The strengths of the study include the use of a large dataset inclusive of 100% of female Medicare beneficiaries ages 65 and older who underwent sling surgery in the United States during the study period. This is the first study of its kind to use a claims-based frailty index to assess the impact of frailty on outcomes of sling surgery. Another major advantage of our study is that the data that we used represents real-world women and outcomes. And these are women who are generally excluded from trials, so outcome data on these frail patients is generally quite lacking. Our study is not without limitations, which include the retrospective nature of this study. The data in this study also only represents women who actually underwent sling surgery and may exclude those who are deemed poor surgical candidates. However, this emphasizes that even these frail women who were deemed appropriate surgical candidates still experience significant complications. Additionally, we were not able to distinguish between sling types. However, we know that the vast majority of slings placed in the United States are synthetic midurethral slings, and it's reasonable to confer that this would apply to the entire study population. In conclusion, while there were far fewer slings performed in frail women, as frailty level increased, there was an increased relative risk of both adverse outcomes and need for repeat procedures at 1 year. Given the findings presented today, we suggest that frailty should be strongly considered when counseling older women regarding the risks and benefits of sling surgery. Thank you for your attention today, and I look forward to welcoming any questions that you may have.